Pregnancy confirmed after 4 weeks by UTP, vomiting, and there is a fatigue. Iron folic acid taken and injection TT, because we're supposed to know, we always have to ask whether it's a booked case, whether unbooked case. There's some differences between booked case, unbooked case, or registered case. So always whenever we want to take any antenatal history, because we have to know what are the common illnesses during the first trimester, what are the common illnesses during the second trimester, what are the common illnesses during the third trimester. So it's very important to know first trimester what are the, I'm not asking sign and symptom, illnesses during the first trimester. Mother, she's having some chronic problem, chronic diseases. So it's very important to know. So iron folic acid taken, no history of fever, exposure to radiation, because some gynecologists advise a mother to take some medicine. So advantage if mother she's taking treatment for any fever and malaria, whatever she'll have the problem during the pregnancy. So it's benefit to the mother, not benefit to the baby, because there are chances to have some problem in the children. So drug is very dangerous to the baby. So here, burning, no burning, micturition, leaking or bleeding per vagina. Second trimester quickening felt at 5 months of gestation, vomiting present, ultrasonography done at 10 weeks of gestation, increased frequency of micturition. No history of headache, fever, giddiness, swelling of lower limb, blurring of vision. Third trimester, fetal movement perceived an increase in frequency. Ultrasonography done at 32 weeks of gestation. Postnatal history, delivered baby girl weighing 2.6. So always we have to bother, we have to know what the normal average in a baby weight. So 2.6, that is not a normal term baby. So average baby weight is 3.5 to 4.1, that is average baby weight. So previously what we got concept is 2.8 is average baby weight. This 2.6 is not a normal weight of the baby, right? Baby cried after the birth. One we are supposed to know, if suppose unfortunately baby didn't cry immediately after the birth, there is one big problem with the baby. So entire family they worried about baby didn't cry immediately. They have to cry. Suppose they cried after half an hour, after 10 to 15 minutes, there is a chances to develop hypoxic ischemic encephalopathy. There is a one problem in which the baby, because there are certain stages in the hypoxic ischemic encephalopathy, there is a stage of Sarnar, so they'll have some problems. So always have to bother about whether the baby is having hypoxic ischemic encephalopathy. So there are 3 stages of Sarnar, in which there is a stage 2, the baby, the chances to develop seizures. So one have to know whether the baby cried even after the birth. So that is also called as birth asphyxia. Second, the breastfed with the 1 hour after delivery. Always whenever, whether it's the term baby, whether a preterm baby, whether a term, post-term. So always you have to encourage the mother to give the breastfeeding. And a normal delivery immediately after the birth and cesarean section, 2 to 3 hours, we have to advise mother to give breastfeeding. So no history of NICU admission because baby is normal. Receive vaccination at birth. So certain problem in the newborn, suppose the baby after 24 hours, 3rd, 4th day, so there is a physiological jaundice. What we commonly know there is a neonatal jaundice. Because we never see them, suppose they'll have the big problem with the baby, they'll have the yellowish discoloration within 24 hours. So it's very big problem that you consider as the pathological jaundice. If 24 to 48 hours, the child develops jaundice, so that is the physiological jaundice. So one you have to know, because if the child, we have to examine the baby, immediately they have to refer to us and we have to assessment, there is the assessment of the jaundice, that's with the help of Kramer method of assessment of the jaundice. If suppose the baby, because we have to admit or not, we have to decide it depending based on the serum bilirubin. If the term baby serum bilirubin more than 10, that is normal 0.2 to 0.5 to 2 milligram per deciliter. If the term baby more than 15, less than 15, 11.5, so we're not supposed to admit the baby. In the case of premature baby or low birth baby, if serum bilirubin more than 10, that is the ideal baby to keep under the phototherapy. Right. So receive vaccination, we have to give vaccination. 2 years old child, what we expect a 2 years old child, because we're supposed to know. Previously, we are giving at the age of 2 years old child typhoid vaccination. Now, schedule of the vaccination at birth: BCG, OP, hepatitis; 6 weeks, diphtheria, pertussis, tetanus, hepatitis, H influenza, rotavirus, pneumococcal vaccination. 10 weeks at the same vaccination what is giving at first 6 weeks, that is the 1.5 month: diphtheria, pertussis, tetanus, hepatitis B, H influenza, rotavirus, pneumococcal conjugate vaccination. Fourth vaccination, that is the 14-week gestation, same: diphtheria, pertussis, tetanus, hepatitis, H influenza, rotavirus. And then 9 months we have to give BCG, OPV, and MMR. And because there is a two schedule of typhoid vaccination, previously we are giving typhoid at the age of 2 years and after 3 years. Now there is a two type of vaccination, that is a conjugated typhoid vaccination and polysaccharide typhoid vaccination. So these days we are giving conjugated typhoid vaccination at the age of 9 months. Then again we have to repeat after 2 years. Suppose the child is 2 years old child, we expected two vaccination at the age of one vaccination at the age of 9 months. Then followed by 2 years, we're supposed to give typhoid vaccination. That is a conjugate typhoid vaccination. Suppose if you miss to give conjugate typhoid vaccination, then better we have to refer to give the polysaccharide typhoid vaccination at the age of 2 years. And we have to repeat after 3 years. That is a polysaccharide. If you go for conjugate, we have to give 9 months, and second only 2. Where in the case of polysaccharide typhoid vaccination at the age of 2 years and repeated after 3 years, and again after 3 years we have to repeat. And then the 15 month, again we have the second booster of MMR and pneumococcal conjugate vaccination. And 18-24 months, that is the first booster of diphtheria, pertussis, pneumococcal conjugate vaccination. This is what vaccination expect 2 years old child. Postnatal history. And then next we have to discuss about the development history. Is very important. All the cases you don't miss developmental milestone development history. All the cases you have to take. It's routine. You have to take habit to take the developmental history. So here development history, development history, normal development history, immunization history, immunize up to the age, nutrition history, normal, no deficit, socioeconomic status. So all we have to bother about according to Kupasomic classification, belongs to upper middle class. Then general examination is very important. Sometime in examination we are not bothered about what history you're taking. Only we'll go for general examination system. So general examination, child is conscious, playful and alert, vital, pulse rate 86 per minute, respiratory rate 24 per minute, abdominal thoracic, BP 86 by 24 mmHg, taken in left regular artery, temperature febrile 100 in axilla. Answerometry here, because the slide is made somewhat, and you always have to keep in mind whenever you want to take an history, you have to make column that is the present weight, expected weight, and percentile. Because why I'm asking percentile? Because whenever you want to put any final diagnosis, we have to know whether the child is malnourished, undernourished, nourished. That's why anthropometry, the importance of anthropometry to assess, to rule out the protein and malnutrition. So height, 2 years old child. Actually, if length you have to take less than 2 years, more than 2 years, height. 88 centimeter, weight 12 kg. So always whenever you want to take the pattern of the weight is a normal, and already explained about normal 3.25, 3.5 is after 6 months become double, 1 year triple. So normally a term baby who's expected 1 year old child, normal weight is 9.5. So weight is 12 kg. Upper segment, lower segment 1.7, chest circumference 47 centimeter, head circumference 45 centimeter, mid arm circumference 15 centimeter. Head to toe examination. Skull shape normal. We have always, whenever you can see the shape of the head size and shape normal. Fontanelle, we have to see whether close and close. Suppose there are two types, there are many types, but commonly we'll see the anterior fontanelle, posterior fontanelle. Some controversies about the fontanelles, but commonly we bothered about the anterior fontanelle and posterior fontanelle. Fontanel close. If suppose it's not close, delayed closure, we have some condition. Early closure, some condition. So anterior fontanel close 9 to 18 months is closes, and posterior fontanel close 3 to 6 months. Here you have to know, is very important, know color of the hair. So sometimes it's brownish and texture is not good, and there is a flag sign in the case of protein malnourished. Hair black, no color changes. If the color changes, or there's easy applicability in favor of the PM. So eyes, no pallor, interest, biter spot. It's very important to know. The biter spot, always we have to bother about WHO classification vitamin E, because there is some table we have to remember. So biter spot, and we have to see there is some ocular hypertelorism, and ophthalmos. All the condition what we expect in the examination, ophthalmos and exophthalmos, ptosis, all eye problem. So here eyes, no pallor, no interest, no bite on the spot. Then we have to see any abnormality in the ear, nose. Here there is no saddle sign, so is the flattening and the chances to have congenital syphilis, and the no normal. Here there is no recoil of the normal. Here no discharge. Nose normal, no septal deviation. Lips, no cleft lip, cleft palate, sinuses, mouth. Always you have to see the color of the tongue. If color of tongue normal is moist in color, pink in color. Suppose if the tongue is coated, because whenever you can see, ask the patient child to open the mouth. When the child is showing the tongue, if there is a coated tongue in favor of the typhoid fever condition, where you can see the coated tongue, typhoid fever, gastrointestinal tract, GIT. Severe dehydration will have the coated tongue. Tongue, no pallor, no sinuses, oral thrush, neck normal. Nail, always you have to see there is some abnormality of the nail. Dermatoglyphics, you have to see nail, no clumping, no sinuses. Systemic examination here, you would like to know which system you have to involve. This is the
you have it. You have stated.
Thank you. So the system here is the CNS examinations. The CNS examination, we have to see the higher mental function correspond to the age. Cranial nerve examination, normal. All 12 nerves are normal. Motor system, normal. Superficial deep reflexes, normal. No meningeal sign. All other system appear normal. Provisional diagnosis. It is a case of atypical febrile seizure with upper respiratory infection. So we'd like to know what is the definition of febrile seizures. Febrile seizure can be defined as a child whose weight 6 months to 5 years during the high fever, mainly due to the extrapyramidal cause, extracranial cause. Each attack lasting not more than 2 attacks in a day. Each attack lasting not more than 15 minutes, each is become normal. So this is the typical febrile seizures accompanied by the fever, 38 degrees centigrade. This is one of the important problem in pediatric age group. Investigation, what we see, CBP, serum electrolytes, serum calcium, serum phosphorus, magnesium, EEG, neuroimaging, lumbar puncture. Investigation, lumbar puncture, indication, simple febrile seizures, actually complex febrile seizure, because simple febrile seizures there is not indication. Child less than 6 months, standard of care, between 6 and 12 months of age, not received. Recommended dose of H1N1 type B or pneumococcal vaccine, or if immunization status cannot be ascertained. History of physical examination suggestive of meningitis or intracranial infection, that is focal signs, sinuses, cyst, etc. the lumbosacral region. Consider if the patient had pre-treatment with antibiotic. Neuroimaging not indicated in simple febrile seizures, not routinely recommended in complex febrile seizures, indicating for imaging. MRI brain, recurrent complex febrile seizures with post-ictal neurological deficit persisting for more than a few hours. MRI more sensitive than CT for brain disorder presenting with seizures. CT scan may have diagnostic use if there is any strong indication of acute or subacute bleed or structural lesion based on the patient's examination history. Discussion: febrile seizures occurs between 3 months to 3 years. And the incidence of febrile seizures between the 6 months to 5 years. The the, the common incidence is between the 18 months to 22 months. So discussion: febrile seizures occur between 3 months to 5 years of age, associated with fever, but without evidence of intracranial infection or defined cause for seizures and without any cause for seizures. Type of seizures: simple, less than 15 minutes duration, no focal origin of seizures, only one attack in one episode of fever. Complex, more than 15 minutes. Complex, the differences between febrile seizures and complex seizures. There is only 1-2 attack in a day. Each attack lasting not more than 15 minutes, where in the case of complex febrile seizure, number of attack lasting more than 2 attacks, sometime 1 hour. So complex, more than 15 minutes duration, focal features are present more than one attack in one episode of fever. Risk factors for recurrences: major factors, age at first febrile seizures less than 1 year, duration between fever and seizures less than 24 hours, lower temperature at onset of its family history, febrile seizures, the first degree relative, minor, family history of epilepsy, complex febrile seizures, daycare,